Sharifah Sekalala is an associate professor of global health law at the University of Warwick, and she joins us now live from Leicester in the UK. Welcome to the programme. Great to have you with us. Do you think it's really a question of choice between the battle against COVID-19 and HIV/AIDS right now?
So it shouldn't be a battle between one or the other. In some ways, if you think about global health holistically, it enables us to think about ways in which we could think about both of these crises, but also other underlying crises. And that includes thinking about resources, so that we are not allocating too many resources for COVID-19 at the expense of HIV/AIDS. It enables us to think about the ways in which we lock down populations to ensure that even when we lock down populations, people can still access services. But it also enables us to think about our supply chains to ensure that we can always deliver access to antiretroviral medicines for those people who need them the most.
And it has been successful. This is what is important, isn't it? As the global battle against HIV enters its 5th decade, it really has been successful. So, how close are we to undoing all that good work?
So absolutely. So we moved from a period where we had almost nobody on antiretroviral drugs to getting to points where the majority of people who needed antiretroviral drugs were getting them. But I think that we are in real peril at the moment because of the disproportionate focus of COVID-19 and the ways in which governments are focusing just on this one crisis at the expense of other crises. I think the other thing to note is that many governments are also doing things that might not be admirable at the time. So stopping drugs is one of them, but there are also things around clamping up on marginalized key affected populations, such as LGBTQ populations who are already marginalized and might not receive treatment otherwise. And that's really super important for us to think about. Mm-hmm. And I guess my final point is really around the inequity in vaccine access and what that might do for people who might be seeking antiretroviral drugs.
And that leads me to my next question. What differences are there or were there from the access to antiretrovirals and access to vaccines?
Yeah, so in some ways, when you look at the beginning of access to antiretrovirals, we have a really similar global inequity in that the majority of people who were in lots of high-income countries could readily access antiretroviral drugs, but many people in low and middle-income countries could not. And in the early 2000s, we had a lot of negotiations at the international level in order to ensure that people could access these life-saving drugs. But we see that we are seeing that same pattern again, where if you live in a high-income country at the moment, you can access vaccines, but people in low-income countries are having real problems of accessing COVID-19 vaccines because the supply has just simply been used up by high-income countries. And
what needs to change for that supply to be, well, just for those vaccines to get to Africa? Because it's roughly at, 3% now, the vaccination rate, I believe?
Yeah, so it's an absolutely appalling statistic. And I think that what needs to change is that we need to work together globally in order to ensure that we are not having lots of supplies of vaccines that are wasted. So we've had lots of instances. So Canada, the USA, the UK have all wasted lots of vaccines that have expired in countries without ensuring that they get them to the countries that need them most. And that's really absolutely appalling in a crisis. We need to work together to ensure that we are not vaccinating even more and more of the population. So at the moment, in many high-income countries, we're speaking about vaccinating 5-year-olds. And these are not really the people in the greatest need. And we really need to work collectively together to ensure that we are vaccinating the rest of the world, because nobody is safe until we're all safe.
Absolutely. And that's what we're seeing now with the rise of Omicron. Thank you so much. Great to speak to you, Sharifah Sekalala.